Welcome, everybody. We are just waiting a couple more seconds to start. This is the first episode of Vital Conversations, and we will have amazing doctors' conversations geared to the community in order for all of us empower our knowledge. The idea completely is that we are living such an amazing, crazy world that there's not a lot of time to actually read a lot of the new things, and we are bombarded in social media and other areas on how to do stuff, but not necessarily are evidence-based or recommended from your trusted providers. Today, we're going to be having an amazing conversation. And please feel free to share your knowledge, share your ideas, share absolutely everything you have around you, because that way we can interact, learn, and most importantly, be together.
Terrific.
Yeah, that's that. And that's my radio voice.
Nice job, Dr. Shapiro. Very nice.
Whenever we're just finishing a couple more seconds in order to make sure that we are live and running. Familia, officially welcome everybody to Vital Conversations. This will be an ongoing effort from AltaMed and our community to make sure that all of us are there, counted, and most importantly, being part of a healthy conversation in these times of need that we do not know what's happening. And of course, we're how we say it in Mexican Spanish, we're chasing la chuleta to make sure that our families are good. We need trusted sources of information like providers that will give you evidence-based guidelines on how to manage and do things. And I really want to introduce an amazing friend, someone that has been on the community for many years and has been advocating for all of us, Dr. Faustina Nevares, an amazing OBGYN that will be joining us today to talk about making women's health a care priority. Especially right now in times of COVID, we need voices like Dr. Nevares to actually show us what's actually there, what's the evidence, and how can we better prepare in these crazy times to do everything. I want to introduce myself. I'm your host, Ilan Shapiro. And most importantly, I'm here as a trusted source of information for all the community, as well as the Dr. Nevares, that is our medical director of women's health here in AltaMed. Well, welcome everybody.
Thank you.
Dr. Nevares, today we're going to be talking about amazing things. I have one question for you. Right now, as you can see, COVID has changed absolutely everything that we know about health. And most importantly, we have issues with transferring health because we were used to going one-to-one and doing a lot of things with our entire family and going to the clinic. And right now, what are you doing to make us safe when we go to the clinics?
Well, first of all, it's hard to tell people or convince people otherwise without really looking at good data. And so what I did to talk about it, to make sure that it was, first of all, believable, and second of all, truthful, is I looked at the causes of death across the United States, across all women and men, and all ages and races. The important thing to keep in mind is that although we have huge numbers of deaths from COVID, especially in the age 46 and up, the number of people who die from cancer and heart disease are multiples of that, multiples, which means if you're totally hiding from COVID, then you're letting other things go. For instance, the leading cause of death for women in cancer is still breast disease and lung disease. And so that has not changed. And it will not wait for COVID. If you're getting lung cancer, and if you're getting breast cancer, it will likely kill you. And more women die from that rather than COVID. And if you have diabetes or heart disease, well, women over 45 are more likely to die from that than they are to die from COVID. So we really need to get back into a safe way to come in and get our checkups. The hypertension, the diabetes, all of that has to get under control. the early detection of breast cancer, lung cancer, makes all the difference in the world of how your outcome is going to be, and whether or not you're going to die from these diseases, and whether or not you're going to be healthy enough to fight COVID.
Dr. Narvaez, you point out so many things that, we do have telehealth and we are offering telehealth, but there's a lot of the things that you said right now that you actually need to come to a safe place. And one of the things that we have been doing is making sure that from the staff, from the doctors, nurses, everybody that we have in the clinic, and including the patients, when we come in, it's like a security moment that they ask you what like if you're feeling good. There's certain questions they check your temperature, and that way, I think that, and we are making sure that everybody that comes in, the place is cleaner, that safety measures on that part to make sure that they are safe and healthy. You mentioned something interesting regarding mammograms, and we heard a lot of things that are coming out and in, and I see the disparities in our Hispano population and in our community, that we're still hard hit by breast cancer. What are the two recommendations for mammograms? When do I need to do it? When we actually do not need to do it?
Yes. Well, I'm glad you mentioned how much precautions we're taking, because this COVID thing is not going to last 2 weeks or 4 weeks or a month. It'll probably be years. And so we really can't wait for the other things to go bad on us, the breast cancer, etc. But every woman should, otherwise normal, without any other risk factors, start their mammography no later than 50 years old and get them every 2 years until they're 74. And or it might be that, if you're a young woman at 74, we might discover that people are living to be 100, and it might be that you will have mammograms beyond that. It kind of depends on how long you're going to live, but at least by age 50. And then there are some people where cancer runs in the family, or they have a BRCA gene or a genetic disposition that might get their screenings done earlier than that. But the bare minimum by everyone's standards is age 50.
Thank you for that, Dr. Narvaez. And you mentioned another thing, that it's a procedure that sadly we cannot. There's no technology right now to do it at home. It's actually the Pap smears. How can we do it? How can we do it efficiently? Are we doing them right now in the clinics? What are the recommendations?
In AltaMed, we have a couple of ways to get our mammograms. We do still have coaches that have the mammograms and buses that bring the mammogram to each of the clinics. And you can get scheduled through our appointment service. And then there is UMI, United Imaging Incorporated, our radiology service, and they will have multiple sites that can do your mammogram as well. And they're reaching out and calling. I just think that people should realize that if we're calling you, you probably need it. And if we're calling you, it's safe, and we're going to do it in a safe manner. And each one of the people that we contract with have developed safe ways to do our mammograms. But don't let it go. I mean, it would be horrible if you lost your opportunity to catch early cancer, which can be curable, but later cancer can be the cause of death. So it's a really important fight to get over, the COVID stuff. You should not worry about and come in.
That's actually that. Thank you for that. And one of the other things that I'm seeing on the clinics is, there's a lot of recommendations out there for example, pregnancy. There's a lot of things, in COVID times that we can do in telehealth. But what are the things that you recommend? I'm as a pediatrician, as a physician, I'm seeing a lot of like moms getting pregnant, newborns, and stuff like that. What has it changed, and what can you recommend them to be safe, in the community?
Right. Well, the recommendations in pregnancy are actually very similar to the other recommendations. The hygiene is, of course, on the front of the list, that you wear your mask, that you wash your hands, that you maintain distancing, and you don't join large groups. That is all the same. And, we don't have a vaccine for that. But we do have a vaccine for the flu. Now, there is a difference between the flu and COVID. The flu that we remember, the H1N1 that we had a few years ago, that one actually targeted pregnant women, and more pregnant women died than the rest of the population. COVID is slightly different, and so we have to just maintain the same precautions that you would. Still, the CDC has placed pregnant women on a higher risk. So make sure that you do get your flu vaccine if you're pregnant, especially if you're pregnant. And also take the precautions. Now, we don't know enough. We do know that women who get sick get very, very sick. But a lot of women just have asymptomatic COVID and it's fine. When does it make a difference is when you see them.
Exactly.
Breastfeeding.
Exactly. And I have a question for you, Dr. Navarez. And,
Sure.
one of the things that, a lot of my patients ask, between, 16 and onwards,
Yes.
it's worth doing a breast exam. When do I need to do it? And me and the community, why is it so important or not?
Well, it's important to get a breast exam, and it's important to know about your breasts and examine them. We used to teach breast exam as a way to detect breast cancer, and that actually has not been proven to be very useful. You still need your mammograms at age 50, but you should know what your breasts feel like. You should know whether or not you have cysts, perhaps, that develop before and after your period. And also, if you have a hard knot, if you feel it, yes, go in, get checked. But it's important to keep track, but it has not panned out to be the screening test that we hoped it would be.
That I really appreciate that part. And one of the things that we hear about screening and making sure that women's health is on top of the list is Pap smears. Can you tell me a little bit more about them?
Pap smears. That's my favorite topic. We hope to change Pap smears in the future, and what'll change it is going to be the HPV vaccine. In the early part of the last century, people were dying from cervical cancer, and then Dr. Papilov, the Pap guy, changed it because he was looking at the cells to see the changes. So when the changes came through, we would treat women. And actually with Pap smear and screening and early detection, the rates fell down to almost nothing, almost. But then we went into the quest of looking to what is causing this. And again, it's a virus. It's the human papilloma virus that is causing this. And between the papilloma virus 16 and 18, it causes about 80% of cervical cancers. But this generation that's coming up, because it is available, if they get their vaccine, and you as a pediatrician would know that, hopefully at age 11, boys and girls, if they both get them, then we may never see cancer in the future. And to me, it's exciting. A vaccination against cancer. What could you do more? The really good thing is that at age 11 through 15 is the time when your body can mount out a really good response, and you'll stay immunized. And that's why we urge that it happen early on in adolescence.
Dr. Navarez, everybody's asking me, okay, so there's tons of questions that they come to us about the HPV vaccine. And we know that it's awesome, safe, reliable, but a lot of people are going, I'm afraid of a couple of things. I'm afraid specifically on the side effects. Can you tell us a little bit more about that? Have you seen anything that you're worried about?
Not really. I mean, all vaccines run a small risk of course, a little bit of fever, a little achiness after the placement of the vaccine. But honestly, not any more than any other. In fact, it's really quite safe and quite effective. The FDA has pretty much allowed us to use it all the way through, well, for sure by 26 years old. But then after that, occasionally you can get a vaccine when you're older if you're at high risk.
I love that because I do believe that we have seen a lot of things disappear in the past with vaccines, and I think that especially with women's health, that cervical cancer is still one of the worst
Awful.
of absolutely all the horrible things that can happen. And we have some type of shield for our community is one of the most important things. And in your mind, Dr. Navarez, you have seen, women from the OBG part, the obstetric part of it, the pregnancy part of it, and women's health. What are the things that you're worried of? What things of the community needs to know right now on like the top 3 or 5 things that they need to be taking care of?
Well, I think they have to remember that first of all, they should check in with their provider. And we at AltaMed, I think you put in a good word for our video conferencing. Video visits is what they are. So they definitely have to do that at the bare minimum. For a lot of these things, they also have to come in, and I think it's very, very safe. Certainly to get your Pap smears, and that at this time we're still saying cervical cancer screening because we're combining Paps and we're combining tests for the virus. Now, right now we start at age 21. It's every 3 years just for the Pap. And then we go every 5 years if everything's normal after the age 30, but we really have to do the virus check as well. The virus check may be the first line rather than the Pap check starting January, but we're looking at that as changing that so that we check for the virus. If you're negative, we'll see you in 5 years, and that proves to be what's important. For pregnancy, don't miss your visits. Do not miss your visits. Absolutely do not. Now, if your provider says, we've done all the preliminary tests at the beginning of pregnancy, which usually include all of the risks for congenital anomalies as well as infections, and we're humming nicely, then great. Your physician may say, we're fine. Don't worry, we'll miss this one, but I'll see you in 4 weeks. Fine. You'll have a video conference, and that's fine. But don't miss. Please come in. Come get your care, because this virus is not going to wait. It just isn't. And of course, in our particular community, it's diabetes. It's associated with pregnancy, and it's associated to the population in general. And if you need to be treated and you need to take your insulin, you need to take your medication, don't miss out on your medication and don't miss out on your treatments, and stay in contact with your provider, either by televisits, telephone, or actual visits. Don't give up on your health care. We need to see you. This is not going to wait a year. Damage happens to your body.
Dr. Navarez, you raised so many things in my brain right now that, one of the things that I think that you're continuing to say that it's getting into my heart is that even though that we have COVID, that doesn't mean that COVID goes and tells, oh, stop, diabetes, don't come, or cancer, stay away, or you know what, hypertension, no worries, you can work afterwards. I think that all of us are on that line of having those issues, and yes, we were sending the message everywhere, like make sure that you're taking care of yourself, but stay at home. Right now is the moment to make sure that they're doing and taking care of themselves in an actionable thing. And you mentioned vaccines, and what in our women's population, what would be like we already mentioned HPV. What other vaccines can we talk about to make sure that they're having those?
Well, there's all of the childhood vaccines that you know about, and we're assuming that at a certain time they're all done. But we should keep up with our Tdap, which is the pertussis vaccine, especially if in pregnancy, and especially if you're going to be the grandmother holding that baby. You must make sure that your pertussis is up to date, that your flu is up to date. Mm-hmm. And in the more older population, you need to do your pneumococcal vaccines. You need to do your what else do we do then?
I think that one of the ones and the other one that we were talking about, the influenza one, because a lot of, especially right now that we're starting with fall and winter, we need to make sure that our families are, protecting still the whoever's in the family that is pregnant and the kids, because not everybody can actually get the flu shot. That's actually, I hate saying the flu shot, but actually the influenza virus vaccine. Kids from 0 to 6 cannot get it, and certain diseases, people have autoimmune diseases or stuff like that. They just don't have it. Yes.
Right. Well, in the olden days, we used to say, come in and get your Pap smear once a year. We don't say that anymore, and we don't need that. But I do think everyone should come in for a well woman check every year at the very least. And as you get older, over 45, you really do have to evaluate your risk of 3 very important cancers. Well, maybe 4. Lung cancer, which, you shouldn't be smoking. We have enough impurities in the air with our fires and everything. So smoking is really not a good idea. Breast cancer screening, cervical cancer screening, and we shouldn't forget the colon cancer screening, especially in some families. The colon cancer screenings
Yes.
you should have every year, routinely. Every 10 years is probably fine, but we really need to have the well visit cover that. Our diabetes, a hemoglobin A1C once a year should cover it. Make sure you don't develop diabetes, especially if it's in your family history, and hypertension. It creeps up on you when you're getting older, so you really should check it. And young people should check it absolutely, because it can be there all your life. It is the leading cause of heart disease and death. And if you are one of these people who could generally have elevated blood pressures or even diabetes that you weren't concerned about, it would be good to find out early in life rather than later in life.
And like going to the doctor. We're doctors. We hate. I can tell you my story. I hate going to the doctor. It's not one of the most exciting moments of my life. But
Right.
what would you recommend to your patients on how to prepare in a better way to make their time efficient when they are having a doctor's conversation, the one-on-one? How do they prepare with questions? What thing do you think that they should be preparing for?
Well, I think most of the time, if you're afraid of going to go to the doctor, give a call. Give a call, get another opinion, and what is it that you need? And then you'll know exactly, because your doctor will tell you. You're going to need a hemoglobin A1C, or you're going to get this. And certainly women of reproductive age, there's always the contraception. Is it working? Is it not working? What else is new for contraception? The long acting versus the short acting versus birth control pills. If you have issues with your menstrual cycle, menopause, etc., all of these things are things that you should consider at your well woman check. Discuss them. And I really do believe that there's a list of care expectations that the U.S. Preventive Health Service puts out. Go through the whole list. Just Google it. The United States Preventative Health Service Task Force or something like that. Or give us a call and we'll tell you what's missing on your care gaps. And yes, we can do that. We can tell you what we're going to do. And don't be afraid to come in. Are there sick people? Yes, but we are working very hard to keep people safe, especially children. They need their checkups. Little boys and little girls need their checkups. I'll leave it to you because you're a pediatrician.
On that front, and I agree with you. Like having already questions. We all have something like this, or we have some type of paper. Then we don't have any excuse of not bringing questions of something, because you should go there to the doctor and suddenly your mind goes blank. And doctor, any questions? You were like, no.
Yeah.
And no, but that way, and the thing that I recommend is actually having already a voicemail. That way you just click and you do it there. And for our friends in Facebook right now, our recommendation completely is like, prevention is the best thing that we have.
Absolutely.
We already are seeing more problems, and like here in California, it dropped more than 40% the kids that actually haven't had their shots. That's a lot of kids that actually need they're unprotected, and they're imagine we already have a pandemic now. Imagine having measles, whooping cough, all other stuff that can burst to the ground. Then what are we doing? We're making sure that you need to come for your well child, because we need to touch your patient. The same thing as someone that is pregnant. We need to touch you. We need to make sure that your weight is okay. We need to do a lot of things that sadly the technology is not there.
Sure.
And trust me, no kid will be happy if I send by Amazon my shots. They will not be happy. Then they still need to come to the clinic. And that's kind of the stuff that we have.
If they call and just say, what are my care gaps? They will have your chart. They'll tell you what your care gaps are, and your provider will tell you how to get them done.
That's an amazing idea,
That's
Dr.
absolutely true.
Nevares. We have 5 minutes left. And do you have any last minute remarks? Anything that you would like to share with everybody else?
No, I think that that don't let COVID make you sick, even without COVID. And nothing else will wait. Your body will deteriorate if you don't take care of it. So you have to take care of it, exercise, and do all the things that you otherwise would do. The immunizations, the checkups, and all things, including cancer and heart attack, will not wait for COVID to go away. It'll come. So get ahead of it.
I agree completely with you. I think that the prevention it's cheaper than the cure, and having a vaccine instead of spending a couple of days or weeks on the hospital plus the complication is horrible. Same thing with pregnancy, making sure that you're taken care of. And right now, we have been talking about a lot of options, and one of them that we actually have is the virtual care for all of you. No matter who you are, where you are, one of the things that COVID brought us, they actually brought us good things. One of them was actually virtual care. As part of that, you have the option to call us or actually have a video call with us. And not only on the medical aspect of it, not only on when you need a OBGYN conversation, but also behavioral health and emergency dental screenings. And we're opening a lot of things for the community because we know that it's hard. We know that we are all persiguiendo la chuleta. We are running around making sure that our family is safe and understanding, especially with these crazy times. And it's very important, especially right now that we have been struggling as a community with COVID, with the economical aspects of it, changes and fluctuations in our families. It's very important to make sure that you're taken care of. One of the things that we can actually offer, Dr. Nevares, here in AltaMed is actually health insurance enrollment assistance. A lot of the times we do not know where to go or how to do it, or sometimes actually we didn't know that we actually had the right or the possibility of having an insurance because we thought that it was way above and beyond our needs or our means. And that's some of the amazing stuff that we have. And I'm extremely proud to share with you that our communication team with the education team, we have been putting a lot of energy with our community efforts on the altamed.org website. You can actually go there and establish communication with us. You will see our blog. There is altamed.org/women's dash health. And there's a lot of information there for you and for me, for our entire family. Go enjoy it. There's things for women's health that especially this month it's very important to do. And sometimes we just need to talk with someone. And if you need to talk with someone, make sure that you call us at 877-462-2582. Again, 877-462-2582. Llame ya. And that way you will actually know that we're there for you. And on reality, and the last couple of the last minute that we have, I really want to thank Dr. Nevares to be part of this. This has been an amazing conversation. We all have had problems with just understanding education and health, and I'm really, really thankful for jumping in. And I hope that you enjoyed it as much as I did.
Thank you. Thank you very much, Dr. Shapiro. A pleasure.
And I cannot go without actually having some disclosures. Thank you for the entire team that made this possible. This is something that I think that it will start flourishing and it will start changing a lot of the things and giving empowerment to our community. Thank you.